Carcinoma of the rectum can occur early in life, but the usual age of presentation is above 55 years, when the incidence rises rapidly. Often, the early symptoms are so insignificant that the patient does not seek advice for 6 months or more, and the diagnosis is often delayed in younger patients as the symptoms are normally attributed to benign causes. Initial rectal examination and a low threshold for investigating persistent symptoms are mandatory. Bleeding is the earliest and most common symptom. Typically, the bleeding is bright red in color and painless. It can be mixed with the motions or separate in the toilet bowl. It can be indistinguishable from haemorrhoidal bleeding, which is the most common differential diagnosis, particularly in the younger patients. Another important symptom suggestive of rectal cancer is tenesmus. The patient experiences a sensation of needing to evacuate the rectum but is unable to pass stool. This is an important early symptom and is almost invariably present in patients with tumors of the lower half of the rectum. The patient may endeavor to empty the rectum several times a day, called as spurious diarrhea, often with the passage of flatus and a little bloodstained mucus, the bloody slime. There is frequently a change in bowel habit, with a tendency to more frequent defecation and the passage of looser stool. A patient who has to get up early in order to defecate, or one who passes blood and mucus in addition to feces, early morning bloody diarrhea, is usually found to have carcinoma of the rectum. Although a change to looser stools is more common, patients with a stenosing carcinoma at the recto-sigmoid junction may complain of increasing constipation. Pain is a late symptom, but pain of a colicky character may accompany advanced tumors of the recto-sigmoid, owing to a degree of obstruction. Advanced cancers invading outside the mesorectum may infiltrate the prostate or bladder anteriorly, or the sacral plexus posteriorly, giving rise to severe, intractable pain. Weight loss is also a late symptom and is almost always associated with metastatic disease. It is pertinent to mention that many patients with rectal cancer may be asymptomatic and present with unexplained anemia, weight loss and poor appetite.